Everybody high. As we move through 2026, the widespread use of GLP-1 receptor agonists are emerging multi-agonist drugs like triple-agonists is reshaping the definition of health. We are no longer just treating a number on a scale. We are managing a profound biological and behavioral shift. The dual edge of a GLP-1 therapy. These therapies deliver unprecedented benefits, but they also create a new patterns of biological cost that require an active management strategy. The positive effects. Cardiorenal protection. Beyond weight loss, these agents reduce major cardiovascular events and protect kidney function, alongside improving blood pressure and glycemic control. Reduction in food noise. Patients describe a marked decrease in intrusive food thoughts, creating the mental space to move from reactive eating to intentional nourishing. Metabolic reset. We see improved insulin sensitivity and favorable changes in liver fat markers, essentially cooling down systemic inflammation. The hidden cost. Sarcopenic risk, muscle bone loss. Rapid weight loss can include a loss of up to 40% lean mass. Without intervention, this lowers the basal metabolic rate and increases frailty. The nutrient gap. With appetite sharply reduced, total food volume falls. It becomes mathematically harder to hit essential protein, vitamin, and mineral targets in a smaller caloric envelope. The maintenance trap. Abruptly stopping the drug often triggers a ghrelin surge, a biological hunger rebound that can lead to rapid weight regain if a metabolic foundation was not built. How the food industry is adapting. As millions of people shift toward high-density, low-volume eating, the food industry is undergoing a metabolic pivot. Micro meals. Major companies are launching nutrient-dense portions that emphasize 20-30 grams of protein and high fiber in half the traditional volume. Muscle support formulations. Products are increasingly leucine-rich and fortified with specific amino acids designed to signal muscle prevention even during a caloric deficit. Digestive-friendly design. Since GLP-1 slows gastric emptying, the industry is moving toward gentle soluble fibers and probiotics to reduce the bloat and discomfort often associated with the therapy. Your eating practice. Strategies for success. To move from simply eating less to actively nourishing the host, adopt these 4 pillars of sovereignty. First, prioritize the protein first rule. With appetite suppressed, each bite must carry more value. Rule. Always eat your high-quality protein, chicken, salmon, tofu, Greek yogurt, first at every meal. Target. Aim for 1.2 to 1.5 grams of protein per kilogram of body weight to preserve your heart and skeletal muscle. Second, embrace intentional fiber. GLP-1 drugs slow gut motility. The type of fiber you choose matters. Focus. Soluble fibers, oats, beans, lentils support comfortable transit and a healthy microbiome. Hydration. Always pair increased fiber with adequate fluids, 2-3 liters per day, to prevent constipation. Third, the training window mindset. The first 6-12 months on therapy is a neuroplastic window. Use the absence of food noise to practice safety recognition. Learn to stop when you feel neutral rather than stuffed. Palate resort. Retrain your taste buds to enjoy whole food while the craving center of the brain is quiet. Fourth, supplement wisely. Because total intake is lower, you may have micro gaps. Basics. Discuss a high quality multivitamins, vitamin D3, essential for bone turnover, and omega-3s with your clinician. Avoid. Steer clear of unregulated metabolic boosters. Focus on filling gaps, not chasing magic. Summary. The sovereignty approach. The real promise of GLP-1 therapy in 2026 is not just a smaller body, but a more metabolically resilient and functional one. By understanding how the food ecosystem is shifting and deliberately shaping your protein and fiber strategy, you move from being a passive patient on a drug to the active architect of your health span. Thanks for likes and sharing.